Psychotic disorders represent some of the most misunderstood conditions in mental health. Often portrayed inaccurately in media and popular culture, these disorders are surrounded by stigma and misconception. In reality, psychotic disorders are complex neurobiological conditions that affect how a person perceives and interprets the world around them. Today, we'll explore what psychotic disorders truly are, their various types, how they affect people's lives, and the treatments that offer hope and recovery. By understanding these conditions better, we can foster compassion and support for those affected, while dispelling harmful myths that prevent people from seeking help. What are psychotic disorders? Psychotic disorders are serious mental health conditions characterized by a disconnection from reality. The term psychosis refers to a state in which a person has difficulty distinguishing between what is real and what is not. This disconnection manifests through symptoms that fundamentally alter how someone experiences and interacts with the world. The core features of psychotic disorders include positive symptoms, not positive as in good, but rather additions to normal experience. Hallucinations, sensory experiences that occur without external stimuli, such as hearing voices or seeing things that aren't there. Delusions, fixed false beliefs that persist despite evidence to the contrary. Disorganized thinking and speech, difficulty organizing thoughts logically, leading to disconnected or incoherent communication. Negative symptoms, reductions in normal functioning, diminished emotional expression, reduced motivation and initiative. Social withdrawal, decreased ability to experience pleasure, anhedonia.
Poverty of speech.
Cognitive symptoms, problems with attention and concentration. Memory difficulties, challenges with executive functioning and decision-making. It's important to understand that psychotic disorders exist on a spectrum of severity and presentation. They affect approximately 3% of the population at some point in their lives and typically first emerge in late adolescence or early adulthood, although they can develop at any age. Types of psychotic disorders. There are several distinct psychotic disorders, each with unique characteristics. Schizophrenia. The most well-known psychotic disorder, schizophrenia, affects approximately 1% of the population worldwide. It's characterized by persistent psychotic symptoms, lasting at least 6 months, significant social or occupational dysfunction, and both positive and negative symptoms. Contrary to popular belief, schizophrenia does not involve split personalities. That's a different condition entirely. Schizoaffective disorder. This condition includes features of both schizophrenia and mood disorders. People with schizoaffective disorder experience psychotic symptoms similar to schizophrenia, plus significant mood episodes, depression, or bipolar-type symptoms. For diagnosis, psychotic symptoms must be present even during periods of mood stability. Brief psychotic disorder. As the name suggests, this involves a short-term period of psychotic symptoms that lasts at least 1 day, but less than 1 month, after which the person returns to their previous level of functioning, often triggered by extreme stress or trauma. Schizophreniform disorder. Similar to schizophrenia, but with a shorter duration, symptoms last between 1 and 6 months. If symptoms persist beyond 6 months, the diagnosis typically changes to schizophrenia. Delusional disorder. Characterized primarily by the presence of 1 or more delusions that persist for at least 1 month. Unlike schizophrenia, other psychotic symptoms are minimal or absent, and functioning is less impaired outside the realm of the delusion. Substance-induced psychotic disorder. Psychotic symptoms that develop during or shortly after substance intoxication or withdrawal. Common substances that can induce psychosis include alcohol, cannabis, hallucinogens, stimulants, and certain medications. Psychotic disorder due to medical condition. Psychosis that results directly from another medical condition such as brain tumors, epilepsy, stroke, or certain infections affecting the brain. Shared psychotic disorder, folie à deux. A rare condition where a delusion develops in an individual who is in a close relationship with someone who already has an established delusion. The content of the shared delusion is similar to that of the primary person. Understanding these distinctions helps clinicians develop appropriate treatment plans and provides those affected with clearer information about their condition. The experience of psychosis. To truly understand psychotic disorders, we must try to comprehend the lived experience of psychosis. While everyone's experience is unique, there are some common elements. Hallucinations can involve any of the senses. Auditory hallucinations, hearing voices, are the most common. These voices may comment on the person's actions, give commands, or engage in conversation. They often feel as real as actual voices and can be deeply distressing. Delusions can take many forms. Persecutory delusions, beliefs that others are trying to harm or conspire against the person. Referential delusions, believing that neutral events, objects, or people have special significance directed at the person. Grandiose delusions, false beliefs about having exceptional abilities, wealth, or importance. Somatic delusions, false beliefs about having a serious illness or physical abnormality. The experience of psychosis often includes feeling intensely confused and frightened. Imagine suddenly being unable to trust your own senses or thought processes, the very tools you use to navigate reality. This can lead to profound anxiety, fear, and sometimes social withdrawal as the person struggles to make sense of their experiences. Many describe psychosis as a gradual process rather than a sudden break. Early warning signs might include increasing suspiciousness, unusual thoughts, perceptual changes, and declining functioning before full psychotic symptoms emerge. Causes and risk factors. Psychotic disorders arise from a complex interplay of factors. Current research points to multiple contributing elements. Genetics. Having a close family member with a psychotic disorder increases risk. Multiple genes are likely involved rather than a single schizophrenia gene. Genetic factors may account for approximately 80% of the risk for schizophrenia. Neurobiology. Disruptions in brain chemicals, neurotransmitters, particularly dopamine and glutamate. Structural and functional brain differences, including reduced gray matter volume in certain areas. Abnormal neural connectivity and information processing. Environmental factors. Prenatal complications and exposure to viruses during pregnancy. Birth complications involving oxygen deprivation. Childhood trauma and adverse experiences. Cannabis use in adolescence, particularly high-potency varieties. Urban living and social disadvantage. Migration and minority status, likely related to social stress rather than ethnicity itself. The current understanding is that psychotic disorders typically develop in individuals with genetic vulnerability when exposed to certain environmental stressors, what's known as the stress vulnerability model. This explains why not everyone with genetic risk develops these conditions, and why environmental factors alone are usually insufficient to cause psychotic disorders. Diagnosis and assessment. Diagnosing psychotic disorders involves a comprehensive approach. A thorough clinical interview is central to diagnosis, exploring symptoms, their onset and duration, impact on functioning, and any family history of mental health conditions. Medical examinations and tests are typically conducted to rule out other conditions that can mimic psychosis, such as brain tumors or lesions, certain infections, metabolic disturbances, seizure disorders, substance use or withdrawal. Standardized assessment tools help quantify symptom severity and track changes over time. Collateral information from family members is often valuable, as individuals experiencing psychosis may lack insight into their symptoms or be reluctant to discuss them. The diagnostic process should be culturally sensitive, as cultural background significantly influences how symptoms are expressed and interpreted. What might be considered a delusion in one cultural context could be a normative belief in another. Early diagnosis is crucial for better outcomes, as evidence shows that the duration of untreated psychosis correlates with more challenging recovery. Unfortunately, many people experience symptoms for 1 to 2 years before receiving appropriate treatment. Treatment approaches. The good news is that effective treatments exist for psychotic disorders, and outcomes are continuously improving with advances in care. A comprehensive approach typically includes medication. Antipsychotic medications are the foundation of treatment for most psychotic disorders. They work primarily by regulating dopamine and sometimes other neurotransmitters. First generation, typical, antipsychotics, effective for positive symptoms but with higher risk of movement-related side effects. Second generation, atypical, antipsychotics, often better tolerated with fewer movement side effects, though they may have metabolic side effects. Long-acting injectable formulations can improve adherence by reducing the need for daily pills. Finding the right medication and dosage is often a process of careful adjustment to balance symptom control with side effect management. Psychosocial interventions. Cognitive behavioral therapy for psychosis. CBTP helps individuals recognize and challenge distorted thinking patterns and develop coping strategies for hallucinations. Family therapy educates family members and improves communication. Social skills training addresses negative symptoms and social functioning. Supported employment and education helps maintain meaningful activity and structure. Cognitive remediation addresses cognitive symptoms through targeted exercises. Coordinated specialty care, an integrated treatment approach that combines medication, psychotherapy, case management, family education and support, and educational/employment services. This model shows promising results, especially when implemented early. Community support. Assertive community treatment, ACT, teams that provide comprehensive services. Peer support from others with lived experience of psychosis. Housing assistance and daily living skills training when needed. Management of co-occurring conditions. Many people with psychotic disorders also experience depression, anxiety, substance use disorders, or physical health conditions that require concurrent treatment. Treatment is most effective when it begins early, is comprehensive, involves the person actively in decision-making, and addresses all aspects of functioning. Recovery and living well. Recovery from psychotic disorders is an ongoing process that looks different for each person. The concept of recovery has evolved beyond simply eliminating symptoms to include finding meaning and purpose in life, developing a positive identity beyond the illness, building satisfying relationships, managing symptoms effectively, achieving personal goals. Many people with psychotic disorders lead fulfilling lives with the right support. Maintaining treatment consistency, recognizing early warning signs of relapse, developing strong support systems, finding meaningful activities and roles, managing stress effectively, taking care of physical health. The recovery process is often nonlinear, with periods of stability interrupted by symptom fluctuations or relapses. Each person's journey is unique, with different challenges and strengths. It's worth emphasizing that many remarkable individuals throughout history who made significant contributions to art, science, literature, and other fields lived with psychotic disorders. With appropriate treatment and support, people with these conditions can and do lead productive, meaningful lives. Reducing stigma and supporting others. Despite advances in understanding and treatment, psychotic disorders remain highly stigmatized. This stigma creates additional suffering and barriers to recovery. We can all contribute to changing this by educating ourselves and others about the biological and environmental nature of these conditions. Using person-first language, a person with schizophrenia rather than a schizophrenic. Challenging media portrayals that link psychosis with violence. People with psychotic disorders are far more likely to be victims than perpetrators of violence. Supporting mental health parity in healthcare systems. Being compassionate and present for those experiencing these conditions. If someone you know is experiencing psychotic symptoms, stay calm and listen without judgment. Don't challenge hallucinations or delusions directly. Express concern and offer to help them connect with professional support. Remember that behind confusing symptoms is a person struggling with a difficult experience. Early intervention is crucial, so encourage professional assessment if you notice concerning changes in thinking, perception, or behavior in yourself or others. With continued research, improved treatments, reduced stigma, and compassionate support, we can create a world where those experiencing psychotic disorders have every opportunity to recover and thrive. Understanding these conditions is the first step toward that important goal.